Welcome to New Possibilities. I speak truth, the power without fear. As we know, there's a crisis going on, not only in America, but around the world. There's a pandemic going on. You have this coronavirus that is plaguing the planet right now, and it is impacting the United States right now. You have many governors who have issued stay at home orders so that they can stop the spread of this deadly virus in the United States. There are over 368,000 cases of the coronavirus, and over 10,000 people have died as of today, according to CNN and Johns Hopkins University. And just like with many things in this society, this virus, despite the fact that a virus doesn't discriminate, despite that, this virus is impacting our community to a greater extent than it's impacting any other community, according to the information that's available right now. According to CNN, over the 72% of the COVID-19 deaths in Chicago are Black. And Black people only make up 30% of the population there. We see that in Michigan, 40% of the COVID-19 deaths are Black people in Michigan. And Black people only make up 14% of the population in Michigan. We see that in Illinois, Black people are 30% of the COVID-19 cases, but only make up 14% of the population. In Milwaukee County, Black people are 46% of the COVID-19 cases, but Black people only make up 26% of the population. This deadly virus is impacting our community to a greater extent than it's impacting any other community. And as reported in Essence and other places like NPR and other sources, it's impacting us greater because of several things. The limited access to healthcare that many of our communities have. We have limited access to healthcare. You also have economic issues where many of our people are on the front lines of this war against this virus. Many of our people are those workers that are constantly exposed to the public. We're the bus drivers. We're the service people at these grocery stores and other stores that are still open during this pandemic. We're the police officers. A disproportionate number of Black people work in the public sector. A disproportionate number of Black people are service workers. So we're more exposed to this virus. And then when you look at the fact that Black people disproportionately suffer from these pre-existing conditions that make people more vulnerable to this virus. Pre-existing conditions such as asthma, diabetes, high blood pressure, obesity. All of these things make us more vulnerable. And you have Congress calling on the Center for Disease Control to gather this racial information, this racial data about this virus, because as it stands right now, only certain jurisdictions that are voluntarily gathering this information are able to gather the information. Whereas you had a CDC that affects the entire nation, if they were able to gather this information, we would have even a clearer picture of how this virus is impacting Black communities harder than other communities. And this is information is key if we're to understand how we need to address this structural racism that continues to exist, where Black people are disproportionately poor, disproportionately subject to environmental hazards, uh, basically denied certain access to healthcare, treated differently by healthcare professionals. All of these issues are highlighted by this deadly virus and its impact on our communities. So I want to hear from you. How has this situation impacted you? And also there's other reasons why this virus is impacting us more harshly. Because unfortunately, there's myths out there, false information being spread out there. You know, Initially people were saying, well, black people can't get this virus. So you had a lot of people not taking this stuff seriously. Then you had these conspiracy nuts out here telling you that this thing is not real. So you have people downplaying the significance of it. You have people not engaging in social distancing when we know that social distancing and proper hygiene are ways to prevent the spread of this virus. A lot of people aren't taking it seriously. I go out on the streets of Baltimore, driving to get things that are essential, going out only for food, only for things that are most important, pursuant to the governor's orders. And while I'm out, I see people just hanging out, not taking this stuff seriously. While this pandemic is going on, you still have these drug dealers on the corner selling drugs. You still have these dope fiends on the corner getting high in large groups, congregating. So this virus is continuing to spread. And then when you have the homeless population that's not being properly looked after, and that homeless population is disproportionately black. So these are some of the reasons why this virus is spreading the way it is spreading. But we have the power to defeat this virus. We need to maintain social distancing. If you don't have to go out, don't go out. If it's not for something essential, don't go out. In many states, and it's just unfortunate that you have this lopsided application of this. You had some states that didn't take this virus seriously, like the governor in Florida. He didn't have any kind of stay-at-home orders. He allowed people to party it up during spring break and all that kind of stuff, congregating at parties and on beaches, spreading this virus, this deadly virus, to their loved ones, spreading this virus throughout the country. So you need federal leadership. You need to have a governor, a governor, presidents that realize the importance of this situation. I mean, you have Trump, who has the power to order that people around the country stay at home. But instead, he's allowing these governors to just make up their own mind, where you have situations where lots of states, quite a few states don't have any kind of stay-at-home orders in place. Meanwhile, their citizens are spreading this stuff, and they don't just stay confined in those particular states. They travel to other states and spread this stuff. So it's not being confined. So we need to have real leadership on the federal level, on the state level, to address this problem. And I'm glad that you have members of Congress standing up, demanding that the Center for Disease Control gather this racial data around the impact of the COVID-19 virus. And you need to have more people stand up. We need to stand up in all of our local communities and demand that our politicians put forth legislation collecting this important racial data and economic data dealing with this virus. So thank you for listening. I'm interested in hearing from you. Please rate, comment, subscribe to the channel if you haven't already done so. Peace and blessings, everyone, and be safe out here. Maintain your social distance from people. If you have to go out, stay at least 6 feet away from people. And, I just have to share a little bit more information about this. This virus is very contagious. They're saying that, according to some reports, they're saying that the virus is not only spread by people coughing and sneezing, but also by people talking. That can spread the virus because little droplets come out of people's mouths when they talk. Also, according to one report put out there by a professor from MIT, one of the top-notch universities in the country, said that virus can spread not just within 6 feet, but we can project droplets as far as 27 feet. So it's important for us to follow these orders that have been imposed, the stay-at-home orders, the social distancing. So anyway, with that, peace and blessings, everyone. Be safe. Please adhere to the guidance that's being put out there about social distancing.